Hi guys, welcome back to HHG Studios. And for those of you joining us for the first time, a special welcome. I've always been interested in acupuncture. And guess what? Today I'm with Dr. Tracy Ann Brown, acupuncture and Chinese herbal medicine physician. And we're going to talk about that. I may even allow her to do a few demonstrations on me. We'll see about that. So, come with us. So here we are with Dr. Tracy-Ann Brown. And Dr. Tracy.
Yes, ma'am.
How does a young Jamaican lady decide to study Chinese medicine?
I'm happy that you're calling me young. You know, it's a question I get very often.
Yes.
And sometimes I'm not quite sure how to answer the question. But I recall from as young as in prep school, I always wanted to do a profession that I thought was one where I could help people.
Yes.
And then I had an interest in the healing and healthcare. My mom being a retired nurse, I always had an interest in healthcare. And somewhere towards the end of high school, I developed an interest in Asian culture, and it just seemed like a natural progression to me. I mean, to be honest, my background, my initial training is in computer science. So I did graduate from the University of the West Indies with a degree in computer science. But after that, it felt like a natural progression to study Chinese medicine.
And where did you actually study?
So I studied in New York as well as in California. Initially in New York, I did 3 years, the acupuncture program, and then I went over to California to Samra University of Oriental Medicine and finished up my herbal training there.
Okay.
And then thereafter I did my doctoral training at Pacific College of Oriental Medicine.
Okay. Did you just go straight through?
I didn't go straight through my doctoral studies. I did the initial professional studies, which was 4 years in all. And then I worked for a while, practiced for a while, and then did my doctoral studies then.
Okay. So tell us a bit more about what is acupuncture to start with.
Sure. So acupuncture is a part of what is called traditional Chinese medicine. And traditional Chinese medicine, also known as Oriental medicine, involves the practice of acupuncture, herbal medicine, cupping. You may have heard of cupping, moxibustion. It's over 3,000 years old. So it's not a new medicine.
Yes.
So it's been practiced for a very long time. It's practiced both originally in China, but it's practiced throughout the world. So in many parts of the world, in the US, in Australia, in Europe, Chinese medicine is practiced. And it's most popularly known for acupuncture.
Yes.
Acupuncture.
But that's just a part of it.
That's just a part of it. And acupuncture involves the insertion of very thin needles, which I'll show you a little later on.
Yes.
It involves the insertion of very thin needles at specific acupuncture points. And there are close to 1,000 acupuncture points in the body.
Really?
Each acupuncture point has a specific function. Each acupuncture point is needled to a specific depth. So there's a certain way you manipulate the point, and there's a certain function for each acupuncture point. The acupuncture points are categorized into what we call meridians or pathways. And you'll see on the charts that you'll have, for example, the lung meridian, and the lung meridian has 22 acupuncture points on them. And these points are on both sides of the body. So you'll have 11 on the left and 11 on the right. You have the stomach meridian, and there are 90 acupuncture points on the stomach meridian. Similarly, the bladder meridian, the small intestine, the large intestine, the liver meridian, the gallbladder meridian. And you have some what we call extraordinary meridians, which have additional acupuncture points on them. So each of these points are categorized into meridians. So all the points on the lung meridian, for example, work on respiratory issues.
Okay.
So a person might come in with shortness of breath. They may find that they cough a lot. Persons who suffer from things like long COVID symptoms, but just this persistent nagging cough, will choose acupuncture points on the lung meridian to help with respiratory issues. No. Not all acupuncture points on the lung meridian help with all lung issues or all respiratory issues. There's a certain amount of what we call differential diagnosis that goes on, which means that, you know, depending on the kind of symptoms that are presenting as relates to the lungs, you'll choose your acupuncture points that are needled. The lung meridian starts on the big finger, on the thumb.
Oh.
It starts on the thumb, runs along the outer arm, and ends on the chest.
Where the lung is?
In the middle of the chest.
The middle of the chest?
In the middle of the chest.
Okay.
Yes, yes, sir. you have the heart meridian, which works on any kind of cardiovascular disease or cardiovascular concern. So it helps with things like blood pressure, hypertension, palpitations, racing of the heart. The points on the heart meridian also help with anxiety, insomnia as well. And there are 18 points on the heart meridian.
Okay.
And it runs along the arm, so it runs from the chest, a different position on the chest now, and runs on the inner side of the arm to the little finger. So
you actually put the needles along this path?
So the acupuncture needles are inserted at the acupuncture points.
Okay.
So when you're needling, for example, on the face, obviously you're going to needle very shallowly because you don't want to go too deep.
Yes.
It's not a very fleshy area. When you're needling on the arms, perhaps, on the thighs and the calves, you will need a little deeper.
Okay.
You have more flesh to go into, so the stimulation is a much stronger on the fleshier parts of your body.
So, I'm trying to decide whether I'm going to allow you to stick needles into me.
I know.
So tell me, does this hurt?
For the most part, no. Most people are very comfortable with acupuncture. Most people fall asleep while I'm doing acupuncture on them. Yes. So the needles are really pretty thin. And what you need to remember is that nothing is being inserted into the body in terms of a fluid. So nothing is being withdrawn. No blood is being taken from the body. So these needles don't have that hollow center that other types of needles will have. So these needles are very thin. So they go in very smoothly. Minimal discomfort to no discomfort. Most people are pleasantly surprised at how little they feel. Yes. And again, as I mentioned, they fall asleep during treatment. Okay. So it's relaxing usually.
Okay, so you think I should try?
I think you should try it.
What are some of the common issues that you treat with acupuncture?
Good question. So most people come in for pain management, and pain management as it relates to joint issues. So persons with arthritis who have joint changes, starting to have some bone diseases, acupuncture is helpful in the management of pain in that area. Also muscular injuries. So persons who have suffered from a muscular injury or they're experiencing muscle spasms, muscle tightness, athletes find acupuncture very helpful for the relief of muscular pain. And quite apart from musculoskeletal pain issues, headaches, migraines, pain related to the menstrual cycle. Acupuncture is also very helpful in the management of those pain, generally speaking. So I'll also have patients who are perhaps cancer patients who experience pain as part of the presentation of their disease, and acupuncture can be helpful for that as well. And in those cases, I find I rely more on auricular acupuncture. And auricular acupuncture is points in the air that are used to treat pain as well. Apart from pain management, acupuncture is sought out for insomnia, anxiety, infertility, popularly. Many people find it surprising when I mention fertility as one of the things that is people seek out acupuncture for, but it is. And certainly persons who are doing assisted reproductive technologies such as IVF or IUI, usually or oftentimes acupuncture is recommended as a lead up to the transfer in that kind of scenario.
What is the response like in Jamaica to this type of medicine?
The interest is growing. Certainly when I started my practice, and
Which is how long ago?
Which I started practicing in Jamaica 2005.
Oh, it has been a little while.
2005, yes. So it's been a few years. And, and it's interesting because when I started to practice, I didn't even know there was a Chinese medicine doctor here in Jamaica. Only to come back and realize there were a few. So it wasn't new. It wasn't new in 2005 for there to be acupuncture being practiced.
But certainly,
not as many people knew about it then as they do now, because it's people are more aware of acupuncture and Chinese medicine now. But it wasn't a foreign idea completely to many persons. And so what has happened over the years is that having gotten acupuncture and been successful in a treatment with a patient, they may then inquire about treatment for other types of issues. And, with that, you'll get calls from the same patients to ask you to treat other things. And then, of course, they send their family members.
Yes.
So then in that way, it grows. My practice has grown. The interest in what Chinese medicine can do grows. And certainly, you know, the interest in herbal medicine is there because I think Jamaicans have a certain amount of natural trust in herbals.
Yes.
And
yes,
so,
that's
you
for
know,
sure.
they're interested and they're curious. And, you know, interestingly, there is some overlap in the herbs that are used in Chinese medicine as well as in Jamaican
Really?
culture. Not many, but there are a few herbs that overlap. So for example, turmeric, which is a popular herb, is used not just in Jamaica, but also in Chinese medicine and in Ayurvedic medicine, which is Indian medicine. Turmeric is used for pain management. So it's useful for joint pains. Persons with arthritis can use turmeric. Also, persons with gynecological issues, such as what we call dysmenorrhea or pain with the menses. Turmeric is also a good herb to use. The only caution with turmeric is that if you're pregnant, you shouldn't take it.
Okay.
Right.
Okay.
So outside of turmeric now, you have ginger.
Oh, yeah.
And ginger is good for any number of stomach ailments, so nausea, vomiting, tummy upset. Ginger is a good herb to use. Nutmeg is a herb that is used in Jamaica as well as in Chinese medicine, obviously by a different name. We call it Rudu Kwao. And nutmeg is used if there is diarrhea. Now, not all diarrhea you'd want to use nutmeg for, because sometimes you need to allow it to run its course, but nutmeg can be used in certain types of diarrhea. Loose stool.
Okay.
And of course, you wouldn't use too much of it because it's also an hallucinogen. So
Really?
you don't use too much nutmeg, which is why it's good to only use a bit of it when you're making a hot cocoa.
Oh, you know, I've been doing that. I've been adding nutmeg to
your chocolate.
Yes.
Yeah, it has a lovely flavor, but you don't have to use too much.
Okay.
And by too much, I mean a whole teaspoon
Okay.
at one time. You wouldn't want to have that much.
Does nutmeg also reduce the chance of vomiting?
No, it's not really used in that way. It's more for diarrhea and loose stool and bowels.
Why I say that is because I remember traveling once on the bus when I was very young. And my mother gave me nutmeg to put on my tongue.
I've heard of people using it that way, so probably it's useful for that as well. It's not documented as such in Chinese medicine, but I've heard of people using
African
it for that.
Medicine.
You never know. But I've heard of it used that way as well.
Yes.
Orange peel is also a herb that is used to help with phlegm and mucus accumulations in the body. In particular, it's used for nasal congestion, sinus congestion. And the greener the orange, the better. So the green orange peel, you boil it in some water and you can drink the tea twice daily. It helps with nasal congestion, sinus issues, just helps to break up that accumulation of phlegm.
Well, I'm happy to hear that because I have the sinus issues.
Yes, it's very helpful.
Especially at this time.
Yes.
You have a lot of persons coming to you at this time of year?
Yes. Okay. And so in that case, usually it's a combination of acupuncture and herbal preparations that we use to manage those kind of allergic reactions and the congestion that comes on at this time of year.
Okay. Okay. So tell me, how long are these treatments? Do you have to come for several sessions? Are there treatments that are just one session? You know, just give us an idea.
Sure. So some people, one treatment is adequate, that's sufficient. They'll do one treatment and they're good to go and they're back to normal and everything is fine. Okay. There are other cases where you have a chronic long-standing issue and you may need to do more than one session. And in fact, most of my patients are suffering from a chronic condition. So usually we're looking at doing more than one session. In the early part of treatment, it's usually once a week. And that usually is for the first month. Thereafter, we may decide to do it every other week, once a month, but it really depends on how a patient does with each treatment and how they respond to treatment. So if things are going along well and after the first 2 sessions, things are looking great, I might say, come back in a month or come back in 2 weeks or 3 weeks. But it really depends on how a person responds to the treatment. And, you know, as I mentioned before, we may make a decision to do just acupuncture alone, acupuncture alongside herbal preparations. There's cupping that we add sometimes to the acupuncture. And, you know, in that way, the treatment is very fluid and dynamic and specific to what is going on with the patient.
Okay. What is cupping?
So cupping is a suction that is created on the skin. It lifts both the skin and the muscles just below it. You can either do stationary cupping or sliding cupping. Stationary cupping, you create the suction, it's left in place on the skin. When you do sliding cupping now, you slide it along the muscle band or along a specific area, so you can manipulate a wider area with sliding cupping.
Okay.
And so that's more used for muscle spasms, muscle injuries, muscle tightness.
Okay.
When persons complain about tightness in the back, tightness in the shoulders, cupping is usually appropriate. Athletes who have had injuries, muscular injuries, cupping is also appropriate. You can also do cupping for respiratory issues. So persons who suffer from asthma, cupping on the upper back can also help with that treatment as well. And also you can do cupping and just put it in the stationary cupping on a specific acupuncture point just to stimulate the acupuncture point. And you could also do the cupping over the needle. So you could put the needle in and put the cup over it and create the suction just to create that extra stimulation of the acupuncture point.
Okay. So what's the success rate like?
So that's probably the most important question.
Yeah.
And my experience is that most people benefit from acupuncture and Chinese medicine. You know, with pain management, it's uncommon for a person to do acupuncture and they not have some relief in terms of pain. So most patients will notice an improvement in the pain. Persons coming in for insomnia, anxiety, most persons report improvement in the sleep, reduction in anxiety. There are patients who come in for blood pressure management, for cholesterol management, and most people just overall report an improvement in their symptoms and the condition that they wish to treat. And as I mentioned, you know, there are quite a range of issues that people seek out acupuncture for and Chinese medicine for. And what I would just add is that the World Health Organization endorses the use of acupuncture for a very long list of health conditions, the top of which is pain management and other things. Persons do acupuncture for post-stroke rehabilitation. So persons who have movement deficits, speech deficits, find acupuncture is helpful as a part of their protocol for rehabilitation. And in fact, in China, you know, when persons suffer from a stroke, part of their initial treatment is not just, you know, pharmaceuticals where necessary or physiotherapy, but also acupuncture, because it's part of the plan to help to get a person back up and going again following a stroke. And in those cases, you want to get the acupuncture going as early as possible.
And there are certain, with pharmaceuticals, there are side effects that are not necessarily so good over the long term, especially. Are there side effects to acupuncture and cupping?
So the only side effect of note with cupping is that you might bruise. And by bruise, I mean there's a red mark that's left after the cupping, and that's really only with stationary cupping. But that goes away. That's not painful. Cupping is not meant to be a torturous experience. You might see
I'm happy to hear that.
You know, but some persons remember Michael Phelps, the swimmer, the Olympian, who had these huge red marks on his shoulder, and they looked as if somebody was beating him silly. But it looks worse than it's cupping, and it looks worse than it really is. But it's not an uncomfortable experience. And that's what I would call a side effect. But it's not an unpleasant side effect. It just looks red. With acupuncture, the side effects are minimal to none. There is caution, of course, when you're inserting a needle in a person. And so when you're needling the chest or the upper back, there's always the caution in terms of how you needle to prevent a pneumothorax, that's the puncturing of the lung. But, you know, a trained acupuncturist knows how to needle. You don't needle perpendicularly, you needle at an angle so as to prevent that kind of complication. So acupuncture in and of itself doesn't have any side effects from the administration of acupuncture, so to speak. When you move into herbal medicine now, there are more cautions to be had, because then you're looking at interactions with perhaps other pharmaceutical medications that a person is on, and what are the types of health issues that they may have. So for example, if your person is coming in for, say, hot flashes, and I'm giving them herbs for hot flashes, you're using herbs that are considered cooling herbs. You wouldn't give them herbs that are heat-creating herbs, because it could make the hot flashes worse. So, you know, there are contraindications for herbal preparations that have to do with just, you know, all of what is going on with a patient, or maybe because of an interaction with some medication that they're taking otherwise. And so it's always important to get a full medical history before you do any treatment. So, you know, that's part of what is done in Chinese medicine. You find out, get your history, you find out what medications a person is on, you decide is that a herb appropriate, or should I use a different herb instead?
Okay.
And usually, because there are several hundred herbs in the pharmacopoeia, you're able to make that kind of decision. You can choose this one over that one because it will work better for the patient. Because you may be treating one thing, but there are other things to consider in a person's medical history, so as not to exacerbate an issue that is already presenting.
Yeah. Okay. Is there an age limit to who can get acupuncture?
No, not at all.
It's suitable for children?
It's suitable for children, in fact.
As young as?
Babies. In fact, my older daughter, as a baby, she had acupuncture at about 6 months old. She had a little cough. So we put in 3 acupuncture needles. Well, I put in 3 acupuncture needles on her. And she was quite calm, no crying, no fussing, because the needles are thin.
Yes.
And it helped her with the cough to resolve it quickly.
Really?
And in fact, I have a few patients about the age of 10, 12, 13 who are like footballers or track and field
stars.
and they will have an injury every now and then, and they come for acupuncture, usually very surprised. They usually want a photo afterwards with the acupuncture needles in, so they can show their friends. But children come, they get the acupuncture, they tolerate it very well. In fact, they do better than some of the adults.
Okay. So, and elderly, it's okay as well for the elderly?
Definitely.
Okay.
So let me show you a few of the acupuncture needles that I use, as well as some of the cups. So you'll notice that the acupuncture needles will come in different lengths. On the face, on the ear, we use the shorter needles. On areas such as on the arms, on the calves, a slightly longer needle is used. And in fleshier areas such as the lower back, in the hips, in the buttocks, this needle is used. And if necessary, we use an even longer needle. This is approximately 4 inches that can be inserted into the area. And this is on a thicker person that would use this kind of needle. There's also something called an intradermal needle. An intradermal needle is a needle that is left in place post the acupuncture treatment. And what you have here is a very thin needle. It's hard to see, but it's a very thin needle, very short, and there's some tape around it. So you put it on the acupuncture point, usually on the ear, and you leave it there. And the tape holds it in place, and it's able to stimulate the acupuncture point post the acupuncture session. So, I use it with my patients who have chronic issues. So if you have pain that is really difficult to manage, you leave the acupuncture points in on the ear that perhaps corresponds with the lower back or with the knee or with the neck, just to continue the stimulation of those acupuncture points and help with the pain relief in that situation. These are my cups. Cups are different sizes depending on where you're going to needle. For facial rejuvenation, which is like helping to make the skin look fresher, more plump, we use these silicone cups, and you apply it to the face to help to minimize the appearance of fine lines, help with some of the sagging under the chin and in various parts of the face. In the lower back, or on the lower back, you might use a thick cup like this, and you apply it to the lower back. You can use it on the entire back, as a matter of fact. Across the neck, I might use a smaller cup, and you can also use these. And the good thing about these silicone cups is that because of their ability to take on different shapes and different landscapes on the body, you really are able to get into a wider variety of areas. So you could even put cups on the shoulder, in the area of the knees, to help with pain management as well. This is a glass cup. Doesn't have the same amount of flexibility as a silicone cup, but it's still very effective on the lower back, for example. One thing I want to point out, something called electrical stimulation. And electrical stimulation is usually a part of a pain management treatment. So having inserted the needles, perhaps the thicker ones going into the thicker areas, you clip. So let me just show you what it might look like. You may have a needle, having inserted a needle in the patient, you clip this to the needle, and you turn your electrical stimulation. It's controlled from this device here, and it applies a very mild electrical charge to the acupuncture point. And because the needle is inserted deep into the body, and again, I'm just reminding everybody, when I say deep, it doesn't mean it's painful, it's just deep. It's just deep. It's deep, and then by applying electrical stimulation, you're able to have the stimulation be stronger and help with the increase the pain management or pain relief ability of the treatment.
So guys, I'm at that point where Dr. Tracy has convinced me that I can handle this. So instead of running out of the office at this point, I'm going to take up the challenge.
So we're going to do 3 acupuncture points. The first is the one called Yin Tang. We're going to do one called Li4, which is a point which is very helpful for headaches and migraines. All 3 points. So this is one of the main migraine and headache points, along with this one. This one has the added benefit of being a point that just helps to relax the body. It also helps with insomnia. So I'm just going to clean the area with a little bit of alcohol first.
Okay.
Ready?
I think so.
I think so too. I think you're ready. You're good.
Close my eyes.
Close your eyes.
So the needle is there now?
The needle is in.
Okay. That's not bad. Not feeling very much.
So all your needles are in. Usually in a treatment, anywhere between 10 to 20 needles are inserted. And once that is done, patient is left with them for about 25 minutes. And usually I hit the lights, leave a person to just rest a little bit.
So this is the point that you say they sometimes fall asleep.
And this is where most people fall asleep.
Really? Okay.
So the most you might get is a drop of blood when you take out the needles. Nothing significant. No blood. So now we're going to do a little cupping. I'm going to have you take off the blouse and roll over onto your tummy, and then we'll get started.
All right.
Lift your legs for me, please. So what we're going to do here now is just apply some oil on the area before we start the cupping, just to reduce any friction in the area. So having put on the oil, we're going to apply these 2 cups. And what happens is that I squeeze the cup, the skin and the muscles just below it get sucked up into the cup, and we're going to slide it along the area just to manipulate the muscles, the muscle fiber, just to relax any muscle tightness, any muscle spasms in the area. And with this procedure, sliding cupping, you're not going to see too much redness following the treatment. You might see a little redness temporarily, just for a few seconds, but most of that is resolved once we're finished cupping, and you won't expect to see any bruising afterwards.
Dr. Tracy-Ann, this has been such a great experience, and I'm so happy that I took the chance and allowed you to stick me with those needles and so on. It wasn't painful at all, and I'm really just happy that I actually came.
I'm happy you came, and I'm happy you enjoyed it.
Yes. Is there anything else you might want to add at this point?
I would love to add that, for persons who are suffering from menopause and hot flashes and irritability that might accompany it, acupuncture and herbal medicine offers support for that as well. I know there's some women who suffer silently with the hot flashes and
Yes.
the night sweats. There are herbal preparations that I do prepare and offer patients for that as well.
Okay.
Yes.
Okay. So guys, I hope, like me, you found that so informative and that you're going to give it a try. I think I'm going to follow up for my sinus issues. So thanks for watching and see you next time.